The Maritime Center for Pelvic Floor Health at the IWK was designed to help patients get the right care, understand their bodies, and to better manage pelvic floor health. Today, we will talk about some of the problems we see and what you can do on your own while you wait for an appointment. The pelvic floor is made up of muscles and connective tissue that support the bowel, bladder, urethra, and uterus. These muscles can allow you to control the release of urine and gas. Pelvic floor issues we see in the center include stress urinary incontinence, leakage of urine when you cough, sneeze, laugh, lift, bend, or move. Urge urinary incontinence, or overactive bladder, is a sudden strong urge to urinate, and you may not be able to hold it until you get to the bathroom. You may leak a large amount. You may also have urinary frequency, voiding more than every 2 to 3 hours, or waking up more than twice a night to void, which we call nocturia. Mixed urinary incontinence, a combination of both stress and urge incontinence. It is important to determine which symptoms are most bothersome to help devise the best treatment plan. Fecal incontinence, involuntary leakage of stool, solid or liquid, or gas. Pelvic organ prolapse, when pelvic organs fall from their original position down towards the vagina, causing bulging of the vaginal walls. This can involve bladder, uterus, or rectum. Many people will manage their pelvic floor health with self-management strategies and lifestyle changes, at least initially, while they wait to see a healthcare provider. These can include achieving a healthy weight, eating well, regular, low-impact exercise, drinking adequate fluids, avoiding constipation, avoiding bladder irritants, coffee, tea, pop soda, cocoa, acidic or spicy foods, alcohol, smoking, and carbonated beverages, drinking adequate non-irritating fluid intake around 6 cups per day, strengthening the pelvic floor through exercise and pelvic floor physiotherapy. Pelvic floor strengthening, otherwise known as Kegels, is a self-management strategy. Strength and coordination of these muscles can improve bladder and bowel function. Proper technique is the key to success. Here are some tips to consider. Aim to tighten and lift muscles around the vagina and rectum as if you were trying to stop from passing gas. It is important not to squeeze other muscles as you contract, like your buttock and inner thighs. It's also important to completely relax the muscles afterwards. Strengthening your pelvic floor muscles involves 2 types of muscle fibers. Slow twitch muscle fibers to provide all-day support to your pelvic floor, and fast twitch muscle fibers to prevent leaking when you cough, sneeze, laugh, move, or lift. Example of a pelvic floor exercise program. 10 contractions holding for up to 10 seconds each, 3 times per day. In between each contraction, it is important to rest for 20 to 30 seconds. 10 quick contractions, 3 times per day. These exercises can be done in any position. If your muscles are weak or you're experiencing prolapse symptoms, start in the lying down position. Progress exercises to standing and sitting positions. Integrate the exercises into your daily activities, such as while doing laundry. Contract prior to sneezing or coughing as well, for added support. Strengthen other core muscles to help support your pelvic floor too. Normally, when the bladder is about halfway full, it sends messages to your brain to let you know you will need to go to the bathroom soon. In urge incontinence and overactive bladder, the signals can happen more often due to irritation and habit. Bladder retraining is another important self-management strategy. You can train your bladder to hold urine better and longer, decrease urge to urinate, reduce trips to the bathroom at night, reduce or eliminate urinary accidents, reduce anxiety, and increase confidence. Start by recording a 48-hour bladder diary. Pass urine at regular times every 2 to 3 hours. After a few days, increase the time by 15 to 30 minutes every 4 days using urge suppression techniques. If tolerating retraining, increase by 15 to 30 minutes every 4 days until you can hold for 3 to 3.5 hours. Stick to the schedule. Try not to go to the bathroom between times. If you get an urge to go before the scheduled time, try to suppress the urge by doing 5 to 10 quick pelvic floor contractions, doing a mental activity to take your attention away. For example, count backwards from 100. Stop and sit down on a hard surface or cross your legs. Change your position. Take a couple of deep breaths to calm the urge sensation. Once the urge passes, try to wait until the next scheduled time. If the urge returns, try to suppress it again. Once the urge passes, go to the bathroom at the next scheduled time. Bladder control tips. Use the mantra, "I will pee when I'm sitting on the toilet." Do not severely restrict fluids. However, cut back on fluids after 6 p.m. if waking in the night to urinate. Empty your bladder before going to sleep. Always be sure to fully empty your bladder. Avoid going to the bathroom just in case, which may reduce your ability to tolerate bladder filling. Here in the Maritime Center for Pelvic Floor Health at the IWK, we hope that this information will help you to better understand your body and manage your pelvic floor health.